CRAC engages with the communities of Eastern Connecticut to implement proven practices that reduce the impact of behavioral health challenges across the lifespan. I'd like to welcome you to today's presentation on youth at risk, the alarming trends of prescription drug misuse and polysubstance use among Eastern Connecticut teens. And I present Dr. Jennika Jenkins.
Good morning, everyone. I'm so glad to see you here today, joining me to hear about my data. We'll go ahead and get started. Now, I know that we have 2 hours scheduled. I don't think that we'll need the full 2 hours, but I just wanted to make sure that we had enough time to have a discussion and answer any questions, because it can be a lot of information. So hopefully we'll get through this together and it will be interesting to you. Okay, so before we get started, about me, some of you may know exactly who I am. I am Dr. Jennika Jenkins. I have my PhD in Applied Psychological Sciences from Old Dominion University in Norfolk, Virginia. I served as the data coordinator and the epidemiologist at CRAC from April 2021 to August of 2024. And I'm currently serving as a lecturer at the University of Rhode Island in the Department of Psychology, teaching quantitative methods and research methods to some reluctant undergraduates. So another thing about me, I'm originally from Georgia, but I'm now living in Connecticut with my 2 wonderful cats. I'm one of those childless cat ladies. Happy to be here this morning. Okay, so today we're going to talk about the background of this research, emerging trends and patterns of substance use, risk and protective factors, what we can do to prevent youth substance use in our community, and then we have some time for some questions and discussions. Okay, so that's going to be the format for today. So let's go ahead and get started. So what is this? Well, this is a study that I actually did to complete my PhD. So I looked at youth substance use, and typically when we do look at youth substance use, we're typically looking at individual substance use or single substance use. So we have a percentage of youth who are using alcohol. We have a percentage of youth who are using cannabis. But we rarely ever kind of look at the collection of use, because just because someone is saying that they're using alcohol, it doesn't mean that's the only thing that they're using. So we're kind of missing out on a very informative piece of information there. So typically, we can see over the years that single substance use has been declining, which is great. Pat ourselves in the back, we're doing wonderful. But polysubstance use may be on the rise. And because it's not something that we typically keep ourselves informed of, like the NISDA and the WIRE-BSS, those national surveys, surveillance surveys, they don't typically report on polysubstance use either. We're not really sure. So in order to better inform ourselves regarding what's truly going on, especially with Eastern Connecticut youth, I utilized CRAC's regional youth survey results to investigate patterns of substance use rather than looking only at individual substance use. Okay, so I'm sure you guys are familiar with CRAC. They're our wonderful partners and hosts today. So I want to talk a little bit about the Regional Youth Survey in case you are not familiar with it. So this is a regional surveillance effort in Eastern Connecticut. It's designed to collect behaviors and attitudes surrounding substance use, gambling, mental health, and associated risk and protective factors. It is administered anonymously to youth enrolled in grades 7 through 12 in schools within Eastern Connecticut. We typically do this in partnership with local coalitions and schools. And for this study, I utilized information specifically from the years of 2021 to 2024, which gave me a sample of 14,134 students, which is a wonderful sample to work with. Now, this is a historical data set, so CRAC has actually been collecting this data since 2006. But because of the pandemic and because we wanted to be as relevant as possible, I decided to utilize information from the years 2021 to 2024. I want to talk a little bit about what the sample characteristics are and what that actually looked at or looked like. So when we looked at the binary gender, which would be just male and just female, it's about roughly equal. We had 45.6% females and 47.4% males. Now we had about 7% gender diverse individuals. And what this means is anyone who is identifying as transgender female, transgender male, gender fluid, non-binary, non-gender conforming. If they're not sure, they prefer not to say, they prefer self-describe. All of that is gender diverse. Now, the sample was 56.8% Caucasian, 14.2% multiracial, 13.7% Hispanic, just to give you kind of an idea. And we had a rough split pretty much between rural and urban periphery areas. Suburban, we didn't have a lot of representation from, but to be fair, in Eastern Connecticut, I don't believe we had a lot of towns that are categorized as suburban. So this kind of makes sense given what we're working with. Now, I do want to point out that 77.4% of this sample of the 14,134 that I'm working with were from the Southeast region. Okay, so we're talking Norwich, New London, et cetera, that lower region. We have 22.6% that were from the Northeast region. So this is more representative of the Southeast region. And this is for a multitude of reasons. The Southeast region tends to have more student enrollment. They're more populated. And we have partnerships with Southeast region that are more longstanding given CRAC's history in and of itself. Now, the one last thing I want to point out here is that we have a pretty good distribution of grades. Okay, I'm looking at 7th through 12th grade. And the highest percentage that I have is, I think, 9th grade, which is 19.1%. But it's pretty equal, which is great. Now we'll move forward. So I'm not going to go too technical with what I did for the data analysis because that's not what we're here for. We're here to understand what we can do with this information. Okay, so I just want to give you a rough idea of what exactly it was that I did. So what I did is I used latent class analysis to examine patterns of substance use and polysubstance use among youth. Okay, and latent class analysis is a statistical analysis that allows patterns to emerge given responses on the variables included so that the researcher can actually look at it and sort them into groups. Now, what this means is that I put all of these variables, and they're all substance use variables. So I have alcohol, cigarette, tobacco, e-cigarettes, cannabis, energy drinks containing alcohol, illicit substances, pain medications, steroids, downers, tranquilizers, uppers, and over-the-counter medications. All of those variables were put into a model. And the latent class analysis looked at that, and they looked at a pattern of responding for individuals. So based on that, they were able to say, okay, here are this number of groups. So it just uses statistics to be able to give you that information. And then the researcher is able to look at it and say, okay, these look like experimenters. These look like people who are doing polysubstance use currently. So it's an interpretive analysis. It's very helpful. And I just wanted to point out that one of the strengths of this analysis that I did here today is the fact that I included so many substance use variables. Typically, you don't include that many. Typically, they'll, especially if you're working with adolescents, researchers will make sure to include alcohol, cannabis, cigarettes, and e-cigarettes because that is the most common endorsed substances. But it is so, so important as researchers and prevention specialists that we remain open to understanding what is actually happening in our youth and see if there might be an emerging trend with a different type of substance. So I did that wonderful analysis and I got 4 classes of substance use. Okay. And again, these are patterns and I'll walk you through what that means. So the 4 classes that I got were non-users, alcohol, cannabis, and e-cigarette experimenters, prescription drug and alcohol experimenters, polysubstance users. So I have this one, I love this chart. I love this chart. So what I'm about to do here is I'm about to walk you through where everyone lands. So on the axis here, on the y-axis, we have probability. Okay, so the LCA gives you the probability that they're going to give you an answer based on the variable, which is along the x-axis here. So if we look at non-users, these are non-users. You can see that the probability that they're saying yes to using anything is low. This is a lot of, so they're characterized, non-user are characterized by their strong probability to say that they've never used anything. And this is looking at lifetime substance use specifically here. And lifetime substance use is defined as experimenting ever in your lifetime. All right. So have I ever smoked a cigarette? Even if it was just a puff, have I ever done it? And so if you have, then that would be characterized as lifetime substance use. Okay. Now, the next group is alcohol, cannabis, and e-cigarette experimenters. And so we can see how they're falling here. So I want to draw your attention to, first and foremost, alcohol, which is the first column here, is super high. So we see that they're more likely to say that I have ever in my lifetime used alcohol. Now you can see that the next highest prevalence or probability is e-cigarettes. So they have experimented with e-cigarettes, cannabis, and energy drinks with alcohol in them. Okay, so that's pretty much, those are the most probabilistic answers for this group. Now I have another group, which I labeled the prescription drug and alcohol experimenters. And this is how they are looking. So we see that they have a higher probability of endorsing ever in lifetime use of alcohol, ever experimenting with alcohol. But more than that, they have a higher probability of ever experimenting with pain medications, and they have a higher probability of ever experimenting with downers. And do you see how this characterizes them? They're reacting differently to these substances. They're answering differently in how they're engaging with these substances than the other groups. And now, polysubstance use in particular is always characterized by, it has to be co-use, right? So in order for someone to be labeled as polysubstance user, they have to let me know that they've been using all of these substances within the past 30 days. So right now we're talking about lifetime substance use experimentation. So if we look at polysubstance users, we see that they have a higher propensity to experiment with cigarettes. They're, of all the classes, they have the highest probability of experimenting with illicit drugs. And I believe that's for their lifetime experiences. That's where they stand out. Now, I also want to look at recent substance use probability, which this is where my polysubstance users are really going to stand out. So if we look at non-users, they're not using. Okay, that is what we're seeing here. Now, alcohol, cannabis, and e-cigarette experimenters, while there is some probability that they've used in the past 30 days, they're far more likely to endorse ever in lifetime use. So these are really like experimenters in their lifetime. They're not really actively co-using multiple substances. And the same thing is true of the prescription drug and alcohol experimenters. We see that there is a slight propensity to maybe have used in the past 30 days, but they're really not characterized by that. The probability is still pretty low. And finally, here is the polysubstance users. Now, this group is showing a very high propensity or probability of saying, I'm using e-cigarettes and I'm using cannabis in the past 30 days. And so this probability, when we're talking about probability, it only goes up to 1. So the highest probability that you could possibly get is 1, which means, yes, this is happening. And so we're seeing probabilities that they're using this above a 0.7. Okay, that's very high. So they are using, in the past 30 days, alcohol, e-cigarettes, and cannabis. Okay. Now, I also wanted to show you the prevalence by grade, so you can kind of see where these things are falling. And what's interesting here is if you look at the alcohol, cannabis, and e-cigarette experimenters and the polysubstance users, the percentage increases as grade increases. So 3.37% of 7th graders are experimenting with alcohol, cannabis, and e-cigarettes. But 20.26% of 12th graders fall into that category. If you look at polysubstance users, less than 1% of 7th graders are falling into that category, but 6.21% of 12th graders are falling into that category. So do you see how there's kind of a progression over time? This is what we expect to see, because we know that as youth age, they tend to experiment a little bit more, okay? Now, interestingly, the prescription drug and alcohol experimenters, it's more prevalent in the 7th and 8th grades, right? We're showing a drop-off as they get older. So that's unique. That's different. And this group in and of itself has not been found in the literature previous to this. So this is a very unique group. Is this an emerging trend? Is this something that's happening now that is related to the opioid epidemic? We're not sure. And we're going to get more into it and I'm going to discuss it further. But I just wanted to point that out, that we have more younger, middle school aged youth experimenting with prescription drugs and alcohol than we do as they get older. So what is happening here? Now, talk a little bit about the characteristics of each class, because I know that's a lot of information. So first and foremost, the characteristics of non-users. This class was by far the largest class, okay? 81% of the sample fell into this class, okay? Prevalences range from 92.35% in 7th graders to 71.54% in 12th graders. So non-users are characterized by their abstinence from any kind of substance, okay? And this class was used as the reference class, or so we compare all other classes to this. So whenever I say or talk in probabilistic terms, I'm talking about compared to non-users, this other class will perform in this way. Now, this also aligns with national estimates that the majority of youth are actually not using substances. So this is wonderful. This is great news. We know that given in these years and with these samples, 81% of the youth are actually not using at all. Now, moving on to characteristics of the alcohol, cannabis, and e-cigarette experimenters. This was the second most prevalent class. So 11% of the sample fell into this class, okay? And for grades, this ranged from 3.37% of 7th graders to about 20.26% of 12th graders. And this class is characterized by a higher probability to endorse ever in lifetime use of alcohol, cannabis, or e-cigarettes. And although there was some potential for them to use it recently, typically they were better characterized by lifetime experimentation. Now, an interesting point of this class. I mentioned earlier at the beginning of the presentation that typically when we look at youth substance use, we're looking at single substance use, right? And in the literature previous to this, typically they do find a class where it's just youth who are experimenting with alcohol. Now, that is not something that I found in this. I found that if youth are experimenting with a substance, they are typically experimenting with multiple substances. Okay, so in my sample, if they're endorsing experimentation with alcohol, they're likely also experimenting with cannabis, and they're likely also experimenting with e-cigarettes. So that's a really important takeaway of this. It's not just alcohol we need to worry about. If they're experimenting at all, they're going to likely be experimenting with multiple substances. And this was the second most prevalent class. It was the most prevalent substance using class. Okay, so of all of the individuals who are substance using, this is the largest class, and they're experimenting with multiple substances. Now, this is ever in lifetime versus within the past 30 days, but it's still an important thing to notate and understand. Now, I wanted to talk about polysubstance users because although this is the least prevalent class, we only had 3% of polysubstance users in the sample. And remember, in order to be classified as a polysubstance user, they had to be telling me that they were using multiple substances within the past 30 days. So this is ranging from less than 1% of 7th graders to 6.2% of 12th graders. This is the highest risk class. And polysubstance using at all at this early age it's a very big risk because typically as youth who are polysubstance using age, they pick up more substances rather than drop. So they're on a trajectory that is concerning. So right now in this group, they were mostly characterized by the use of cannabis, e-cigarettes, and alcohol within the past 30 days. But they did demonstrate a higher likelihood to ever experiment with cigarettes, tobacco, and illicit substances. And this finding, this research, it corroborates research that finds that adolescents who endorse current cannabis or tobacco use are typically also engaging in moderate multi-use of substances at the same time. So to me, this class is kind of a more high-risk version of the experimenters. from the other class. And we are seeing, and other research has found, that typically the most endorsed substances that youth use are alcohol, cannabis, and tobacco. And we're seeing that too. So this isn't completely outside of the realm of what is normal and what we typically see in youth. However, this group is very different. It's not something that we've seen before, and it is, if I'm honest, the most interesting group that I have found, because I really want to know what's going on with this group. So this was the third most prevalent class. So about 5% of the sample fell into this, but it included more younger grades than older grades, ranging from 4.52% of 8th graders to only 1.98% of 12th graders. So again, this class is characterized by a higher probability to endorse a lifetime experimentation of pain medications and downers, along with a slightly increased probability of experimenting with alcohol. Now, they also have a higher probability of experimenting with prescription medications than they did alcohol, and they have the highest likelihood to misuse prescription drugs across all of the classes. Okay, so they are very much characterized by their engagement and their use of prescription drugs. So what's interesting is that this might be capturing a novel substance use pattern emerging in youth. It could be related to the opioid epidemic that's going on in the United States. Typically, I've mentioned this before, but typically other research doesn't include this level and this multitude of variables. So this might be something that has already been occurring, but it's just not been tapped into or found in this particular way. It could be a blip of something that's happening in Eastern Connecticut. There's simply no real way that we could tell. We would have to research more about this group and understand whether or not this is something that's happening everywhere or if it's just kind of happening here. Now, we did find that this had a higher prevalence among urban periphery areas than in suburban and rural areas. So that might have something to do with it, a difference of experience, but this is a very, very interesting group that I'm very interested in learning more about. So, as a summary, youth who are experimenting with substances are typically experimenting with multiple substances, particularly cannabis, alcohol, and e-cigarettes. Polysubstance users are the most high-risk class and are typically often endorsing current use of cannabis, alcohol, and e-cigarettes, and a higher propensity to experiment with illicit drugs, which is just good to know. And then the prescription drug and alcohol experimenters capture a unique group that was unexpected, that is more likely to experiment with prescription drugs, even compared to the polysubstance use group. So I'm going to pause here and ask if there's any questions.
We do have a question of whether these slides will be made available following today's presentation.
Yes, I will make them available. Yes.
Okay, thank you.
Oh, any other questions right now? Just to give me a moment to catch my breath, or any comments in the text box.
I know it's a lot of information, but there's got to be some things that surprised people, I'm sure, obviously. Can you list the towns included in this study again?
No, I will not list the towns included in the study because it's just not productive to be like, okay, well, you can know that the 77% is in the Southeast and 26% are in the Northeast, but I don't want to identify anyone or risk, disclosing any confidentiality. I only reported in aggregate. So it is representative of Eastern Connecticut, but so I won't be doing that, sorry.
No problem. I was wondering how you were able to run these tests. Can you explain that a little?
Yes, so there's a specific statistical software that you need to run a test like this. I used something called M+. And so what you do is you write a code, and you have the statistical software complete this test. And so what it does is it gives you a list of probabilities endorsed for each of the variables that you put in. And I have more information about this. So if you're interested in looking at my tables or anything, I can absolutely provide that information. I just didn't want to give that here because it can be very overwhelming and it's not quite the point of today, but yes, I can I can provide that. But it just gives you the probabilities, and the researcher, so me, I went through and highlighted the highest endorsed probability to try to make sense of the classes so that I could explain this to you today.
We have another. Did you see differences in large versus small towns?
A bit, yes. So I can at the end, I can look and see further and actually look at my research to give you more information about that. But I do know that there was some differences between, yeah, where they lived and their probability of being included in a particular class. The only one that I mentioned in particular was the prescription drug and alcohol experimenters tended to be in urban areas. And I think urban areas in general were more likely to predict substance using classes. But I didn't do an analysis specifically by town at all. Okay. All right, so hopefully that has sinked in a little. All right, let's move forward and talk a little bit about risk and protective factors. So that was part of my analysis, was to get information about these classes, these patterns of substance use, okay? It was very interesting. But then I went further and I looked at risk and protective factors, and I did what's called, I ran several multinomial logistic regressions. And what that does is it kind of looks at probability. So I put in all of these different risk factors and I say, okay, are these significantly influencing the likelihood of belonging to each of these classes? So that's the analysis that I ran. And again, if you're interested in the actual statistics of it, I can provide you with those tables. You can look for yourself. Absolutely. But I didn't include them in this because this is for the community. So I just want to point out, I did this by domain. I used the socioecological model as a framework, and I grouped risk and protective factors by domain. So in the individual domain, I'll be talking about gender, availability of substances, and perception of harm. In the peer domain, we're looking at peer disapproval. In the family domain, we're looking at parental monitoring, parental disapproval, and parental substance use. In the school domain, I'm looking at school commitment, school safety, and school support. Community domain, we're looking at negative community perceptions and community support. And then mental health is technically a part of the individual domain, but I wanted to kind of bring it out to talk about how specifically depressive symptoms influence your membership in each of these classes. So, all right, let's move forward. So we're going to start by talking about gender. So typically in the research, and you guys might be familiar with this, we typically have found historically that males tend to endorse higher substance use than females. And we're seeing that that's not true as much anymore. So we found that membership in all substance using classes was more likely among youth identifying as female. So this is a shift from what we previously see, because typically we think about substance use as kind of like an externalizing behavior, and males are typically more likely to do externalizing behavior, such as being aggressive to their environment and acting out, and behaviors such as substance use. And females tend to do more internalizing behavior. Well, they will be depressed and kind of withdraw within to deal with difficult times. Now, we're seeing that female substance use is actually converging with male substance use, and if not, surpassing male substance use. Now, this is a big change. We're not quite sure what's causing it, but one thing that could be causing it is shifts in gender roles in our society. I'm sure you all can attest to seeing this and witnessing this. Women have more equality, more opportunities than ever before, and so this might contribute to the differences in behavior because there's a shift in gender roles. So also important, identifying as gender diverse significantly increased the odds of belonging to any substance using class, but specifically it doubled the odds of belonging to the polysubstance using class, and it almost tripled the odds of belonging to the prescription drug and alcohol experimental group. So this may indicate that the circumstances associated with being gender diverse may predispose individuals for that particular substance use pattern. All right. In terms of availability of substances, across all substance using classes, higher perceptions of availability of substances increase the odds of belonging to any of the substance using classes. So when I say that, I mean that it was significantly predicting belonging to the alcohol, cannabis, and e-cigarette group, the polysubstance user group, and the prescription drug and alcohol experimental group. So all of the substance using classes were significantly predicted by perceptions of availability. Now, this was significantly more influential on the polysubstance using class, which indicates that availability of substances is a very strong predictor for engaging in polysubstance use among that group in particular. Now looking at perception of harm. So perception of harm only significantly decreased the odds of belonging to the polysubstance using class, but demonstrated absolutely no relationship with any of the other substance using classes. So it only significantly decreased the odds of belonging to a polysubstance using class. Now, this suggests that perception of harm may not function as prominently as a protective factor as previously thought. And I know a lot of interventions focus on kind of changing that perception of harm for youth, but this is suggesting that this might not be a great use of our time. But it could also be that perception of harm only really kicks in when we're dealing with kids who are actively using substances, right? So polysubstance users are those that are using within the past 30 days. Okay, they are actively engaging with substance use. So of course, that kind of makes sense that their perception of harm would be significantly impacting their use. Okay. Now, looking at the peer domain, we looked at peer disapproval. And we all know that this is a very common protective factor, and it continues to be so. So higher perception of peer disapproval significantly decreased the odds of belonging to all of the substance using classes. And this was slightly different by class. So the strongest effect was on polysubstance using class, followed by the alcohol, cannabis, and e-cigarette experimenters. And the least affected by this was the prescription drug and alcohol experimenter class. So this is interesting because it looks like, if you look at this, the prescription drug and alcohol experimental class, the youth that are populating that class, they are affected by peer disapproval, but less so than any of the other classes. So that's interesting because it's a characteristic about them that might help us understand what actually is going on with them. Now, looking at the family domain, we have parental monitoring. So parental knowledge of children's whereabouts and companions when they're away from home, particularly that, their knowledge of where their children were and who they were with when they're away from home, significantly reduced the odds of belonging to all substance using classes. However, higher levels of unsupervised time were only significantly increased the odds of belonging to the alcohol, cannabis, and e-cigarette experimenters. So what does that mean? It means that if kids were left alone, they were more likely to belong to the alcohol, cannabis, and e-cigarette experimenters. So this is ever in lifetime use. So we are kind of seeing that unsupervised time kind of offers them an opportunity to experiment with substances. This isn't groundbreaking information, but it is interesting that it was only related to this one class. So not the prescription drug and not the polysubstance users. The unsupervised time opened a window to increase the odds of ever experimenting with substances, okay? But parental knowledge of where their children were and who they were with was far more predictive of belonging to a substance using class than the amount of time spent unsupervised. So that particular part of monitoring is definitely more influential and important. Now, looking at parental disapproval. So we all know that parental disapproval is one of the most salient protective factors against youth substance use initiation, And it remains so. So perceptions of parental disapproval significantly decrease the odds of belonging to all substance using classes. And this was the most influential on the polysubstance using class, followed by the alcohol, cannabis, and e-cigarette experimental class, and finally the prescription drug and alcohol experimental class. And again, it remains one of the most influential protective factors against initiation. Now, this was a particularly interesting finding. So when we looked at parental substance use, we found that adolescents were over 6 times more likely to belong to the polysubstance using class if they were aware of parental cannabis use in their household, cannabis use in particular. So, and remember, all of these questions are asked to youth. So all of these are youth perceptions, which is why I said aware of parental cannabis use, because I'm asking kids, do your parents use these substances? And the kids are telling me whether or not they know that they do. So while we found that parental alcohol use also increased the odds of belonging to the polysubstance using class, the cannabis use was much more influential. And we also found that parental use of e-cigarettes, alcohol, and cannabis all significantly increased the odds of belonging to that alcohol, cannabis, and e-cigarette experimental group, which is just suggestive of modeling of behavior, right? They see their parents do it, so they might do it as well. Now, no significant relationships between parental substance use and the prescription drug and alcohol experimental group existed. None of it. But what's interesting about this is that parental cannabis use is kind of a cross-substance influencer. So if they know that their parents are using cannabis, they're more likely to use several substances. It's not a one-to-one because they see their parents using cannabis, they use cannabis themselves. If like it's a generalized risk factor where if the parents are using cannabis in the home, the youth are more likely to use a multitude of substances. Okay. Now moving on to the school. So school commitment is a significant protective factor against membership in the polysubstance using class and the alcohol, cannabis, and e-cigarette experimenter class. There was no relationship with the prescription drug and alcohol experimenters. So it was just the lifetime experimenters and the polysubstance using class. So we know that commitment to school can be a protective factor against the initiation of substance use, but the absence of the relationship to the prescription drug group might highlight a uniqueness to the group because there is a differential pattern depending on or within the school domain. So looking at school safety, this only had a significant relationship with prescription drug and alcohol class. So school safety is like, my school is safe. Do I feel safe at my school? And so higher feelings of safety at the school decrease the odds of belonging to the prescription drug and alcohol class, right? But it had no relationship to the other classes. So this is also very unique to this group. So what does this mean? So school safety is important to these kids. And another thing that was important, or an important predictive factor in this group, is that identifying as gender diverse made them almost 3 times more likely to belong to this class. So it could be maybe that this is a group of adolescents that may be characterized as using substances to cope with anxiety, perhaps due to feelings of threats or discrimination at school. Also remember, when I talked about the peer group, I said that prescription drug and alcohol class was the least affected by peer disapproval, which might also suggest a kind of social alienation of this group that these are all suggestions and like maybe we can put this together to try to understand what's going on here. But ultimately, in order to get a clear picture, we would have to do more research on this group. Now, finally, in the school domain, we have school support, and this significantly decreased the odds of belonging to the polysubstance use and alcohol, cannabis, and e-cigarette experimental classes only, but had no relationship with the prescription drug group. So this corroborates previous research that school support is a protective factor against the initiation of substance use. But the lack of relationship with the prescription drug group may suggest an ambivalence within this group or a lack of relationship, maybe a further social alienation of this group. Who knows? Now, looking at the community domain. So We have two risk and protective factors in this group. We have negative community perceptions. So we found that higher negative perceptions of community significantly increase the odds of belonging to all substance using classes. So this is negative perceptions like my community is a place where a lot of drugs are sold, kids are often teased or taunted, and a lot of kids are into using drugs. So all of this becomes a risk factor for the initiation of substance use. Now, on the flip side of that, when we look at community support, this is a protective factor against substance use. It significantly decreased the odds of belonging to all the substance using classes. So this is perceptions that your community is a safe place, that there are a lot of things for youth to do in your community, and you feel like kids or adults see kids as valuable and important members of the community. So these are all protective. And finally, we looked at depressive symptoms. Now this includes questions about thinking about committing suicide in the past year, struggling with mental health in the past year. This is all within the past year. So higher reported depressive symptoms significantly increase the odds of belonging to all the substance using classes, but in particular, it made them 2 times as likely to be polysubstance users. So, and it was significantly more predictive of being a polysubstance user than just being an alcohol, cannabis, and e-cigarette experimenter, which may indicate that adolescents who are polysubstance using might be doing so due to health struggles. And it's not something I can say for sure, but it might have a relationship there. Now, I'm going to do a synthesis and then pause again for questions. So a synthesis, the classes of non-users, alcohol, cannabis, and e-cigarette experimenters and polysubstance users all tend to be consistent with kind of what we expect to see in youth substance use experimentation, right? Now, the prescription drug and alcohol experimental class emerges. It's a unique class. It might indicate a novel trajectory of adolescent substance use behavior, and maybe it's related to the opioid epidemic because these kids are using downers and pain medications. Now, key protective factors, really important protective factors: peer disapproval, parental monitoring, and availability of substances. And key risk factors were included parental substance use, particularly cannabis use. And perception of harm, we found, is not a particularly salient protective factor. So environmental strategies might be more helpful in prevention initiatives with parents in the school. Okay, so we're going to take a pause here and kind of take a breath, synthesize, and see if there's any questions.
Okay, so we do have a question. It says, I would love to see data on the perception of school safety among students who vape in the school bathrooms. Do they vape in the bathrooms because they feel safe enough to do so? Do non-users feel unsafe in school because they feel uncomfortable using the bathrooms because of other students vaping in the bathrooms? This comes from student reports.
That would be interesting. I didn't look at that in particular in this research study, but it's not outside of the realm of possibility. We could absolutely look at that. Now, I do want to say that I think, I mean, you bring up a good point in terms of what it means to feel safe at school. Because typically the way that I interpreted that was that I feel safe in terms of like a threat to my physical or emotional body. But you kind of took it to, well, I feel safe to kind of like risk it and get away with some things. And that could be happening. So that is an interesting point. I would be interested in seeing that too. Any other questions or comments?
There is a follow-up comment on that says, my students also report avoiding the bathroom due to vaping or only using certain restrooms to avoid vapes. Is your study published somewhere? I would love to read it. The data is amazing. Your sample size is huge, especially for student data.
Thank you. I am working on getting together. This is it's a huge study. My dissertation is published, but it's 172 pages, so you might want to wait until my articles are published. I am working on creating some articles. But if you would like a copy of my dissertation, I will give it to you, and you can admire every bit of those 172 pages. But thank you. I am working on publishing this because it's important data, and I would like to share it. Not only to you guys you are, I'm assuming you're from Eastern Connecticut, the most affected by this and can immediately apply it, but also to the world. Because like, is this prescription drug use happening elsewhere? Is it happening here? Who knows? Okay. So we just have a few more things to get through, and then we can open it up for any discussions or questions. So, and I think we're doing pretty great on time. It's just a lot of information. So, all right, let's talk a little bit about how you can prevent youth substance use in your community. Okay, so most importantly, I think, is to understand the developmental expectations for adolescents, and I'll talk a little bit more about that. Fostering positive relationships between parents and children, as well as school staff and youth. So I know that parents have heard this before, and I know that you all know this, but parents are so empowered, and I think that they're more empowered than they think that they are. They kind of think that they are in the wind with whatever the kids' friends might think or influence them, but parents have so much power. And I think it's really important to share that information. Now, I would also recommend focusing on preventions that target the environment of an adolescent rather than trying to change their attitudes regarding perception of harm. I'm not saying don't ever try to talk to them about their perception of harm, but from this study, we can see that it might not be as an effective tool as perhaps trying to do more of an environmental prevention initiative. And then finally, I think it's important to understand that experimentation with single substances is not really as likely as it is to experiment with several substances. So once they start that experimentation with substances, they're typically going to experiment with multiple. All right, now I want to talk about adolescence as a developmental period to kind of like set the stage here. So we know that adolescence is marked by a period of increased risk-taking and sensitivity to reward peaks between the ages of 15 to 17, okay? So no matter what, we can always expect adolescents to make risky choices. So if given the opportunity to make a bad choice or a risky choice, genetically, developmentally, odds are they're going to do something crazy. And it's just the way that this developmental period is. They're not being like willfully rebellious. Maybe they are, but it's what we can expect. And given the fact that sensitivity to reward peaks around 15 to 17, this is a prime time for substance use experimentation. And we know this because when we look at our data nationally and even in this sample, my substance use experimentation is peaking around 15 to 17. It makes sense. That's 10th, 11th, 12th grade, right? So also their ability to appropriately assess risk is underdeveloped. Okay, so prevention strategies that kind of target their environment will be more effective than strategies that just want to talk to them to tell them to make good choices. Because one thing that we can make sure that we know to expect from adolescents is that they're not always going to make good choices, no matter how much you try to help them develop their risk assessment. They're just not as developed as they should be. And there is a phenomenon in psychology we talk about where it's like an invincibility. They think that they're invincible. They don't consider the true consequences. And I'm sure you guys can look back to your own adolescence and be like, oh my gosh, I could have died. Didn't even cross my mind I could have died. I could have died. And that's exactly what we have here. Their ability to appropriately assess risk is decreased. So we just have to understand that and try to engage them at their level. Okay. Now, another thing I really want to point out here is that adolescents are always going to be more influenced by a positive, warm relationship with their parents and adults than any threat of punishment. Okay, so that's why when we were talking about parental monitoring, parents who know where their child is and who they're with when they're away from home are more effective than parents who are just monitoring or trying to control the environment. Okay, so research has shown that adolescents are not affected by threats of punishment. It doesn't work on them. But what they are influenced by is being worried that they're going to disappoint their parent, right? So punishments and strict monitoring, so like surveillance almost of adolescence, is never going to be as effective as a social emotional investment into the relationship. Further, research has shown that adolescents are actually the gatekeepers to parental monitoring. Okay, and we have found that parents only know what adolescents disclose. So really the power here is with youth. So it's super important to foster a healthy, positive relationship with parents and adults and youth lives. Now, another thing I want to consider before we wrap up and kind of talk is that Connecticut legalized cannabis. Okay. Now, given the legalization of cannabis in Connecticut, youth perception of availability may increase. Their actual ability to access cannabis may increase. Okay. This is a risk factor for substance use initiation and multiple substance use, right? And again, because parental cannabis use was such a salient risk factor for adolescent substance use, multiple different types of substances, it's extremely important to be in front of parents and let them know that they need to, one, model safe use if they're going to, and two, ensure that they are locking up their substances. Because if an adolescent has an opportunity, they're likely going to take it. That's what we can expect from them. Okay. So the best thing that we can do to try to prevent this is to kind of control the environment as much as possible and really foster some healthy relationships with the youth so that they don't want to disappoint and they want to live up to all their expectations. Okay. So for me, that's everything.